Have you ever thought about what it means to truly prepare for pregnancy? Imagine planting a garden. You wouldn't just throw seeds on hard, dry ground and hope for the best. You'd prepare the soil, add nutrients, and water it with care. Your body is that garden, and your baby is the most precious seed you'll ever nurture. Here's what's important to know. Getting your body ready before pregnancy is one of the most powerful things you can do for your baby. The World Health Organization recognizes preconception care as a key strategy for healthier pregnancies. When mothers prepare beforehand, they are 39% more likely to seek proper care during pregnancy, and their babies have a 17% lower risk of dying in the first month of life. Those numbers are not small. They represent real babies, real families, real lives saved. And here's the beautiful part. You don't need to be perfect. You don't need expensive medicines or fancy clinics. Most of the steps you can take are simple, affordable, and you can start today, right in your own home. One young mother went to her very first prenatal checkup and found out she had anemia, something that could have been treated months before she got pregnant. She told herself, "I wish someone had told me to see a doctor before conceiving." That's why this step is so important. A preconception visit is a simple checkup where a doctor or health worker looks at your overall health. They'll check for anemia, diabetes, thyroid problems, high blood pressure, and infections. In Pakistan, where one woman dies every 50 minutes from pregnancy complications, catching these problems early can truly be life-saving. You might think, "My mother never went to a doctor before getting pregnant, and she was fine." And yes, many mothers were. But many also suffered silently from anemia and other problems that nobody caught in time. Think of this visit like checking your vehicle before a long journey. You wouldn't skip that, and this journey is far more important. What can you do today? If you're planning a pregnancy in the next few months, visit your nearest health facility. Even a lady health worker or a basic health unit can help. Just tell them you're planning a pregnancy and ask them to check your blood levels and blood pressure. If there is one single thing every woman should do before getting pregnant, it is this. Take folic acid. This tiny vitamin, costing just a few rupees, can prevent serious birth defects of your baby's brain and spine. Health experts around the world agree. Every woman who might become pregnant should take 400 to 800 micrograms of folic acid every single day, starting at least 1 month before she conceives. For women who've had a previous pregnancy with a neural tube defect, the recommended dose is higher, 4 milligrams daily, starting 3 months before. You can also eat foods naturally rich in folate, dark green vegetables like palak and methi, lentils and dals, chickpeas and oranges. But here's something many people don't realize. Cooking can destroy much of the folate in food. So while these foods are wonderful, the tablet makes sure your baby gets the full amount needed during those crucial first weeks, often before you even know you're pregnant. What can you do today? Go to your nearest pharmacy and ask for folic acid tablets. Take one every morning with your chai or water. It's that simple, and it could make all the difference. Think of your body as a cooking pot. If the pot is empty, you can't cook anything nourishing for your family. In the same way, if your body doesn't have enough nutrients, it will be harder to grow a healthy baby. Try to eat a balanced plate at every meal. Imagine dividing your plate: 1 part dal or beans for protein and iron, 1 part roti or rice for energy, 1 part vegetables for vitamins, and a small portion of fruit or dairy. When you can, add a glass of lassi or milk. Iron is especially important. Your body will need 27 milligrams of iron daily during pregnancy, much more than usual. Start building your iron stores now. And here's a wonderful trick that many mothers don't know about. Squeeze some lemon on your dal or spinach. The vitamin C in lemon helps your body absorb much more iron from plant foods. It's like giving your body a key to unlock the nutrition in your food. You might have heard that eating too much before pregnancy will make the baby too big and delivery too difficult. Actually, the opposite is true. When mothers eat less than 2,000 calories a day, their babies are more likely to be born small and weak. Healthy eating builds your strength. It doesn't make delivery harder. Now let's talk about something important, the advice you might hear from grandmothers, mothers-in-law, and aunties. Much of this advice comes from love, but some beliefs passed down through generations can actually be harmful. So let's gently sort through what helps and what doesn't. You might have heard that you should only eat hot foods to conceive and avoid cold foods like yogurt and watermelon. Actually, there's no scientific evidence that hot or cold foods affect fertility. What truly matters is eating a balanced diet with enough iron, folic acid, calcium, and protein. And yogurt? It's actually excellent, giving you calcium and healthy bacteria. Another common belief is that saffron during pregnancy makes the baby fair-skinned. Actually, saffron doesn't change skin color at all. Your baby's complexion comes from genetics, not food. And in high doses, saffron can actually be dangerous, increasing the risk of miscarriage. Have you ever been told that exercise before and during pregnancy is dangerous? In Pakistan, 76% of people believe even mild lifting causes miscarriage, but health experts recommend 150 minutes of moderate exercise per week. That's about 20 minutes of brisk walking every day. Staying active actually strengthens your body for pregnancy and delivery. Here's a lovely tip for sharing this information with your family. You might say, "Ami, I read that doctors recommend this, and I want to do everything I can for a healthy baby." Framing modern advice as adding to tradition, not replacing it, helps keep family harmony. Now here's your simple action plan. You don't need to do everything at once. Start with what you can and add more steps over time. Progress, not perfection. 3 months before you want to conceive. Number 1, start folic acid, 400 micrograms daily. This is the single most important step. Number 2, visit a doctor or health worker for blood pressure, blood sugar, and hemoglobin checks. Number 3, make sure your vaccines are up to date, especially tetanus and rubella. Number 4, start eating better. Add more vegetables, lentils, eggs, and fruits to your meals. And number 5, if you or your husband use tobacco, pan, gutka, or naswar, start reducing now. 1 month before, check your weight with a health worker. Review all medicines you take, including herbal remedies. Think about your mental health and talk to someone if you're feeling stressed. Get your teeth checked because gum disease is linked to premature birth. And most importantly, talk to your husband. Preparing for pregnancy is a team effort. Feeling overwhelmed by this list? That's completely normal. Just pick one item and do it this week. Even doing 2 or 3 of these things makes a big difference compared to doing nothing at all. Your body gives you many signals about your health. Learning to read these signals can help you know when everything is fine and when you need help. Here are things that are completely normal and do not mean something is wrong. Your period isn't exactly 28 days every month. Cycles between 21 and 35 days are perfectly normal. Mild cramping around the middle of your cycle might actually be ovulation, a good sign. Some clear discharge with no strong smell is normal. And if you've been trying to conceive for a few months without success, that's usually normal too. Most healthy couples take up to a year. But some things do need medical attention. Very heavy periods that soak through a pad in less than an hour. Severe pain during periods that stops you from your daily activities. No period for 3 months or more when you're not pregnant. Unusual discharge with a bad smell, itching, or burning. These are your body's way of asking for help. Please listen to it. Here's a simple step you can take today. Keep a record of your periods, when they start, how long they last, and how heavy they are. This information will be very helpful when you visit your doctor. Preparing for pregnancy is not just a woman's job. When the whole family supports the mother, outcomes are so much better for everyone. Husbands, here's how you can help. Come to the preconception visit together. Learning about your wife's health needs shows you care. Quit tobacco and nasware. Secondhand smoke harms fertility and your future baby. Share the healthy eating by having the same nutritious meals together. Be her emotional support. Listen when she shares her worries. And help with household work when she's tired. That's love in action. For mothers-in-law and families, encourage the couple to visit a health facility together. Support healthy eating for everyone, not just the mother. Share your experience with love, but also be open to what doctors recommend today. And please avoid pressuring about when to conceive. Stress can actually delay pregnancy. One family found that when the grandmother started adding spinach and eggs to the family breakfast, everyone's health improved, not just the mother's. Small changes that help the whole family are the easiest to maintain. Some dangers to your future baby are invisible, but they are very real and very avoidable. Hepatitis B and C are very common in Pakistan. A simple blood test can detect them, and treatment before pregnancy protects your baby. Both partners should also be tested for sexually transmitted infections. And if you haven't had rubella or German measles, get vaccinated now. This vaccine cannot be given during pregnancy, so it's important to get it beforehand. Look around your home too. Some traditional medicines and surma or kohl eyeliner contain lead, which is harmful to a developing baby. Pesticides and cleaning chemicals should be handled with gloves. And if you have cats, ask someone else to clean the litter box. Cat waste can carry an infection called toxoplasmosis that affects unborn babies. You might have heard that traditional medicines are always safe because they're natural. Actually, many traditional preparations contain heavy metals or herbs that can cause miscarriage. Always tell your doctor about anything you take. Natural does not always mean safe for pregnancy. Have you ever noticed how your mood affects everything? Your appetite, your energy, your relationships? Your mental health before pregnancy is just as important as your physical health, but it's often forgotten. If you've been feeling sad or hopeless most days for more than 2 weeks, if you've lost interest in things you used to enjoy, if you're having trouble sleeping, or if you feel constantly worried about things you can't control, these are signs that you need some extra support. This is not weakness. This is your mind asking for help, just as your body would if you had a fever. Many mothers find that simple daily habits help: a 20-minute walk outside, talking to a supportive friend, prayer or quiet reflection, doing something creative with your hands, or simply getting enough sleep. You deserve to feel well, not just physically but emotionally too. If you're already taking medicines for depression or anxiety, please don't stop them suddenly. See your doctor before conceiving so they can adjust your treatment safely. Your mental health is not separate from your baby's health. They are deeply connected. Most of the time, preparing for pregnancy is a calm, gradual process, but some situations need urgent medical attention. Please listen carefully to this section. See a doctor immediately if you experience severe pain on one side of your lower abdomen, sudden unexplained heavy bleeding, fainting, or severe dizziness that doesn't pass, or high fever with lower abdominal pain. These could be signs of something serious, and getting help quickly matters. There's one more important thing, especially for Pakistani families: thalassemia screening. Pakistan has one of the highest rates of thalassemia carriers in the world. A simple blood test for both you and your husband can tell you if either of you carries the trait. If both partners are carriers, your doctor can guide you on your options. This is not something to fear, it's something to know about, because knowledge gives you power over your choices. Before we close, let's bring it all together. You have the power to give your baby the best possible start in life. Here are the most important things to carry with you. Start folic acid now, 400 micrograms daily. See a doctor before you conceive. Eat well and build your strength with dal, vegetables, eggs, and fruit. Move your body, even 20 minutes of walking helps. Quit tobacco, naswar, and pan, and ask your husband to do the same. Share what you've learned with your family, because a supportive home makes a healthy pregnancy. And please, take care of your feelings too. Your emotional health matters just as much as your physical health. You are not alone in this journey. Millions of mothers around the world are preparing just like you. Every small step you take today is a gift of love to the baby you will hold tomorrow. You can do this, and you're already doing it, by learning, by caring, and by preparing. Take care of yourself because you matter, and so does your baby.